Hello, everyone. Welcome to the Flu Lead Pilot Project informational session. We will be beginning this session in just a few minutes. Hello, everyone. Thank you for joining the Flu Lead Linkages to End Access to Disparities, a pilot project to increase influenza vaccination coverage among HUD-assisted residents. We are very excited to have this webinar today to discuss the pilot, and we'll be joined by Justin Mills from the Agency of Healthcare Research and Quality, Jason Omarhaji from the U.S. Department of Housing and Urban Development, and Karen Ingolstad from the Health Resources and Services Administration. Before we get started, I'd like to pass it on to my colleague Fide to go over some housekeeping items.
Thank you so much, Saki. And this is just a reminder to everyone that this is a virtual activity and that to unmute yourself, you would just click on the mute button, make sure that you submit your chat through the chat button. And also, if you would like to raise your hand, there you just click on the raise hand button and we will unmute your line. And also during the Q&A session, we will go ahead and unmute your line as well. I'll pass it on to the next speaker.
Okay. Hello, my name is Justin Mills. I am a medical officer with the Agency for Healthcare Research and Quality and Pediatrician. Before I was with the Agency for Healthcare Research and Quality, I actually was a clinical advisor for the Bureau of Primary Health Care. So I'm very familiar with the health center world and with health centers. Part of my job here today is to kind of give you a brief overview of kind of what the Healthcare Resilience Work Group is doing. So just to let you know kind of the overarching situation here, the work group is one of the 5 working groups that's supporting the Unified Command. So that's the National COVID Response, and that's being led by the Department of Health and Human Services. Although also we're having assistance and collaboration with other departments in the federal government. As the name implies, the Healthcare Resiliency Working Group mission really is to optimize healthcare delivery, really to strengthen healthcare delivery in the face of this current COVID pandemic, and really looking at all healthcare settings. The working group itself is broken actually into 5 different teams, and they're just focusing on different aspects of the healthcare system. So as you can see here, emergency medical services, hospital care, long-term care facilities. The group that we're working with, myself and other colleagues here on this call, are working with the ambulatory team, and that's looking at outpatient settings. And this particular project, the Flu Lead project, is one of the priority pilot projects for our team and for the working group. So, I probably don't have to, go into too much detail around flu and the importance of flu vaccination, especially in the time of COVID. But I did want to touch on things and just really to stress the importance of this. As you can see, or as you probably know, in normal times, in non-COVID times, the flu causes a significant amount of morbidity and mortality. We know it accounts for tens of thousands of deaths. We know it accounts for hundreds of thousands of hospitalizations, that it affects and affects the young and old at higher rates, and they are a kind of high risk group. And we also know that there are large disparities in outcomes for flu. If you look at race and ethnicity and socioeconomic status, we know that for certain groups, we know that flu outcomes are much worse for them than for others. And so, this is obviously a concern, and something that, as community health centers, something that you're probably very well aware of. You're probably also very well aware of kind of the upcoming flu season, this 2021 season, and the issues around COVID and kind of having flu and COVID circulating in the community at the same time. We know that will, pose challenges not only for, illness, but also for being able to administer care during these times. We also know that, there is a significant amount of overlap in the groups that are at risk. We know that, those who are at high risk for COVID and having worse outcomes in COVID are also those who are at high risk for getting flu and having worse outcomes for flu. Now, the good news is that we know that we do have a way to help combat that, and we know that that's flu vaccinations. We know that flu vaccinations can help prevent flu, and we know that they can help reduce morbidity and mortality from flu. And again, especially it's important this year. We know that flu and flu vaccinations can help protect patients. We know that can help protect those patients, their family members, and other ones that they're in close contact with. But particularly for COVID, we know that it will help reduce the burden on the healthcare system. One of the things that I'm very lucky to be able to do is, I volunteer a half day a week in a community health center. And I tell my patients there, as we're preparing for this upcoming flu season, I want them to get their flu vaccine. I love seeing their faces, but if we can keep them out of the healthcare system for something like flu, that's not only good for them, but it's also good for us in the healthcare system and for the population in general. Now, one of the concerns that we have is that, we know that flu vaccine works, but one of the concerns we have is that they only really work if people get those vaccinations. And unfortunately, we know that there are certain populations, especially those like Latinx populations and African Americans, and they have historically lower rates of flu vaccination than we know than our white adult populations, and our populations in general, I should add, including children. And so we've had some time to kind of listen to national associations, different organizations, kind of listen to the concerns of communities around kind of flu vaccinations, and this all in the context of COVID, and really been trying to work out and think about how there are ways that we can improve the rates of vaccination for these communities and improve the health of the population in general in those places. So, with that, I'll turn this over to Jason, and you can talk a little bit about HUD and kind of the work that they're doing.
Great, thanks so much, Justin. So once again, I'm Jason Omarhaji from the U.S. Department of Housing and Urban Development, specifically in the Office of Public and Indian Housing, but we're working on this project with our Offices of Field Policy and Management, which oversees the Envision Center program, and our Office of Policy Development and Research, which helps with data and evaluation. So folks may be familiar with HUD, or specifically HUD-assisted communities. Many of you all work with public housing communities or other communities that have HUD assistance, such as senior and disabled communities. And in particular, our Office of Public and Indian Housing supports many what we call place-based programs or initiatives. These are targeted investments to specific sites that create the infrastructure for resident services, for resident engagement, for really a robust platform of addressing the social determinants of health. So as this slide just sort of indicates, HUD's strategic goals, our current secretary is a former surgeon, and includes, using housing as a platform for improving quality of life. This has been a long-standing part of HUD's mission, and also building inclusive and sustainable communities. So when we think about, access to care and making sure that folks have equitable access to care, I think your all's role really plays a big part of that. So just to give a little bit of context in terms of, the types of housing assistance that we offer and sort of the reach. So, public housing is actually different from other types of housing assistance. Many folks sometimes hear Section 8 or Section 8 is actually a term that refers to a section of the Housing Act, which established a lot of these programs. And in particular, it refers to the Housing Choice Voucher Program. So someone who receives Section 8 assistance actually receives a voucher that they can use to go have housing provided by a private landlord, and their rent is capped at 30% of their income, so HUD pays the rest. Public housing is actually based out of Section 9 of that act, and it's housing that was initially funded, publicly funded for affordable housing and is maintained through congressional appropriations, but it's owned and operated at the local level. So public housing authorities at the state and local level have public housing stock that they operate. And while many people might think of some of the more, let's say, traditional high-rise developments like in New York, which is the largest public housing site in the country, the vast majority of public housing sites are actually more low-rise, garden style, or even in some cases like single-family homes. And so they're dispersed all over the country. We have over 3,000 PHAs, public housing authorities, that run public housing. And then multifamily is a different type of housing that actually is a contract between HUD and private owners. Again, you might have seen like some senior or disabled housing that's specially designated that's funded through the multifamily program. And, HUD is moving more and more to multifamily style contracts of ownership. But, I mentioned these three different types, not necessarily, so that folks have to know the specifics, but because when we talk about some of these programs being anchored in public housing, it really is referring to a very specific type of housing assistance, although our vision for this program is that we would serve anybody in the community who comes to get services. So if someone who gets a voucher comes to a public housing site, that they would still receive it back. Okay, next slide, please. So just to give some context, we provide housing assistance to 10 million individuals, including, 1 million children. So many people think about who lives in public housing. Vast majority are children and seniors, and also working adults. So these would be many essential workers, folks who work, in essential jobs. And housing assistance is not an entitlement. So unfortunately, because of congressional appropriations, we can only serve 25% of the housing needs. So in many cities, there are waiting lists that are tens of thousands of members long. And in some cities like DC, have been closed for new applicants because the housing supply of public housing and the funding for vouchers doesn't meet the demand. So I say that just to say that, when we think about the social determinants, that housing is actually one of the most critical, and that's something that folks who are in public housing or do receive a voucher, have as a foundation. So we're looking to build on top of that, with the goal being to improve their life outcomes, and also then to provide opportunities for additional people to receive housing assistance when people are able to sort of go into the private housing market. And just in terms of the goals of many of our partners, like the Office of Minority Health, we serve a heavily minority population. And so, when you think about wanting to serve low-income individuals or minority populations, oftentimes, working with HUD or public housing is one way to do that. Next slide. So this is just to show, that for many, many years, housing was considered sort of separate, and especially at HUD. But in the past, I would say, decade, there's been a real push to think about housing as integrated with other social determinants of health. And so, this idea of housing as a platform, we see it as tied into the neighborhood and built environment, into, the health system, care system, education, and we have programs that support all these things. So we have programs that help people get access to higher education, childhood reading, in terms of economic stability. Some of the programs I'll talk about in a second focus on economic attainment, but we're really starting to move more intentionally into health partnerships, and this being one of them. But health and housing, I think the link between the two is very well established at this point, and HUD certainly recognizes that. Next slide. So the Community and Supportive Services Division, which runs a lot of the place-based initiatives that I just discussed, is a sort of sub-branch of Office of Public and Indian Housing, and it serves approximately 700 of the 3,000 plus PHAs. So, I would say about a quarter of public housing authorities have one or more programs that we support. Next slide. So you can see here, this is just an example of one of our programs, HUD Strong Families, which is an initiative that has health as one of its three key pillars. It's typically focused every year around Mother's and Father's Day and helping to support families. This year we've expanded it, so there was a youth art competition nationwide during COVID, and this provided an outlet for youth to express their creativity, but also to engage as part of their community. And so we'll typically focus on back to school as one big opportunity, the holidays as another, and it's a program that reaches over 1,000 PHAs that started actually with the Father's Day program many years ago, and is one messaging avenue that we can use to do outreach around flu vaccination. Next slide. This just sort of demonstrates the reach and spread. So, we have the same regions as HHS. So when you think about where we are in the country, many of our housing authorities on the public housing side are focused sort of, east of the Mississippi, and then on the coast, we're a little sparser in some of the western states, but that's also because we have in those areas Indian housing programs that are separate. And this map just sort of gives a broad overview of some of the ones we'll be focusing on: FSS, Jobs Plus, and ROS, in addition to others that work on things like reentry or digital inclusion. So, again, trying to look at housing as a platform to address all the social determinants. Next slide. So there's three main programs that are really part of our focus for Flu Lead. And when you're thinking about partnering with a public housing authority, not all of them will have one of these programs, but many do. And so we want to just give a quick minute to talk through what they are. We can, if folks have questions, certainly discuss more. But basically, one of our most robust programs is Jobs Plus. It's a program that started in the 90s. We're now, into its third decade, maybe even fourth decade of iterations. And we have 45, I think it says 44, but we're now up to 45 sites. And this is a program that's a 4.5-year program. Some cases gets extended, but provides a rent incentive, which is a key component. So folks who are in this program for 4 years, their rent does not go up based on their income. So normally, if you live in public housing or you receive the voucher, you pay 30% of your earned income. This says, if your earned income goes up, that actually you will pay what you were paying before and not what it goes up. So, folks have used the savings from this rent incentive to, achieve many of their goals. In some cases, home ownership, purchasing new vehicles, paying health expenses, tuition, paying off debt, saving for the future. So it's a really robust part of this program. But the core of it is really actually intensive case management and case coaching. So there's case coaches who are hired through the program who work with residents one-on-one. And then the third component is actually, we call them community coaches, but you all will be very familiar with what they are. It's built on the community health worker model. And these are residents that are hired to work with their peers and neighbors as coaches. So they may, help to organize events, do outreach, and, facilitate the work of the case managers and case coaches. So I mention these components because these are all things that can be leveraged for Flu Lead. So the Jobs Plus site, can use this infrastructure to help create partnerships with a local health center, to help leverage the case coaches to, educate residents, can have actually the community coaches doing outreach as trusted members of the community. So, health is an important part of employment and achieving employment outcomes. We see these as very well tied together. And, Jobs Plus, I think, is one natural opportunity for partnership for Flu Lead. The next slide. So this is our ROS program, Resident Opportunity and Self-Sufficiency. This is a service coordination program, so this funds service coordinators. It's much broader. We have hundreds of sites that are part of ROS. And as part of their application, they actually have to mention two of these focus areas that they're going to be focusing on. So, we have, I think, nearly 100 sites that have highlighted health and wellness, or elderly and disabled as one of their focus areas. And again, this is a natural linkage for Flu Lead because these are service coordinators who do partnerships. They do resident referrals. They help organize, programs and events. They do outreach, and they work with resident leaders in the community. So we can think about leveraging, Ross, where there isn't a Jobs Plus site, as an infrastructure for Flu Lead. Next slide. And our family self-sufficiency program is probably the broadest. We have over 700 grantees in the middle of doing the renewal for 2021. And this is actually sort of a hybrid of the two. It has case management like Jobs Plus, but it also includes referral like Roth. And so if people have coaches they work with one-on-one, they also have a rent incentive, which is an escrow account. So as their income goes up, their rent goes up, but that extra money goes into an escrow. And at the end of their term of participation, 5 or 7 years, they can take that escrow out and use it, to buy a home, again, education, whatever their goals are. We see health as being one of the key determinants of success in these programs, and also in some cases a barrier. So, folks work very intentionally to try and make sure that their residents, the people that they're serving through these programs, have access to health resources, and vaccination being one possible opportunity for partnership through Flu Lead. Next slide. So I'm going to hand it off to my colleague, Jill Yu, who runs the Envision Center program out of the Office of Field Policy and Management. Envision Centers are another sort of place-based program that in many cases even overlap with some of these other programs I just discussed, but this is another, I think, wonderful opportunity for partnership around Flu Lead. Okay, I don't know if Jill is on, so I'll just present this. So Envision Centers is actually a secretarial initiative that Secretary Carson has led throughout his tenure, and it's based on 4 key pillars. So earlier I talked about HUD Strong Families and the 3 pillars there, which were health, employment, and education. This includes all of those. So this is sort of different than the programs I just mentioned in that it's not limited to public housing residents or even HUD-assisted residents. These Envision Centers are actually open to the entire community that they serve, and they're seen as central hubs for resources. So they provide like on-site programming, programming space, staff resources, partners in many cases with organizations that operate the space like Boys and Girls Clubs, and they really leverage some of these other investments. So they kind of bring everything together in one site. And even in the time of COVID, where many of these sites are going virtual or having very limited in-person interaction, they still provide locations that could be ideal for a flu vaccination on-site clinic, or even, let's say, outside in the parking lot if it won't, if weather permits. And there's sites that bring people together. So they leverage the HUD field network, and at a very high level, Office of Field Policy and Management works on secretarial initiatives. So they're really keyed in, and these are some of our really all-star sites. So they are sites that have high capacity, that have really demonstrated that they, want to be part of this initiative, which is an unfunded initiative. So without receiving additional funding, that they want to be part of it. And these sites are great opportunities for collaboration around Flu Lead as well. Next slide. And this is just a map of where the locations are. So you'll see it's very similar to the map I showed earlier. This is an expanding program. So, I think the vision by the end of the year is to increase the number of sites even further. And you'll see, perhaps many of the communities that you serve matching up here. So we hope that these would be collaboration opportunities for Flu Lead. Next slide. So I'm going to hand it over to my colleague, Karen, who will sort of talk about this pilot project, and then we'll open it up to some feedback.
Thanks. Thank you, Jason. Hi, my name is Karen Ingolstad. I'm a member of the ambulatory team. I'm from the Bureau of Primary Health Care in the Office of Northern Health Services. My colleague, Judith Van Alstine, is with us, but won't be speaking right now, from the Bureau of Primary Healthcare's Office of Quality Improvement, and she's consulting with us on immunization efforts. I'll give an overview of the Flu Lead project, and there we are on the next slide. So as Dr. Mills described at the beginning of the webinar, increasing flu vaccination coverage this year is a critical strategy for reducing respiratory disease burden, maintaining healthcare system capacity, and protecting populations at greatest risk for negative outcomes. Community health centers and public housing agencies, or PHAs, I might say through the call, have a shared interest in protecting and preventing negative health outcomes in the communities they serve. This pilot project is a partnership between the Department of Housing and Urban Development and HRSA's Bureau of Primary Health Care and the ambulatory team of the COVID-19 Health Resilience Working Group, who have a shared interest in increasing the PHA-wide site-wide influenza vaccination coverage among residents of HUD-assisted public housing agencies. The goal of the pilot project is to increase PHA-wide influenza vaccination coverage by 50% among the residents of the public housing agencies during the 2020 through 2021 flu season, beginning in the fall of 2020. Also to enhance health and health resiliency of residents of HUD-assisted communities, and to create and strengthen partnerships between and capacity in public housing agencies and HRSA-funded health centers. Next slide. The project will achieve our goal of increasing flu vaccination coverage by partnering with HUD place-based supportive services programs like Jason discussed, for example, the Jobs Plus and the Envision Centers, with HRSA-funded health centers that are co-located nearby or serve common residents and patients. So participants in the initial pilot project will focus on matching health centers with HUD's place-based programs in order to leverage the aspects of these programs, which include, for example, the partnership facilitators, the program managers, service coordinators, community coaches, community health workers, and have space such as community centers or service sites. Next slide. The Health Resilience Working Group activities include supporting HUD and HRSA site level mapping in order to identify the specific HUD place-based programs and HRSA-funded health centers as potential partner sites for the Flu Lead project. We are now reaching out to health centers and to select public housing agencies through these informational sessions and by other means to emphasize the importance of flu vaccination as a COVID-19 response measure and to promote community health and maintain healthcare system capacity. The working group will offer materials to support public housing agencies and health centers. Dr. Mills will talk about that later in the presentation. The Health Resilience Working Group also plans to convene a webinar series highlighting successful collaboration models, best practices, and success stories from the Flu Lead partnership. Next slide. A phased approach to this project is outlined in this slide. First, it's a phased approach to first support access to seasonal flu vaccination and expand HRSA-HUD partnership to achieve the shared goal of improving community health and resiliency in HUD-assisted communities. So this slide outlines the roles of the public housing agency and the health center partner in the Flu Lead pilot project. The housing providers will customize outreach materials by adapting existing CDC or other materials with culturally and linguistically appropriate messages. They'll lead outreach campaigns to their residents and can arrange to provide community space if applicable, or parking for a mobile van, again, if applicable. The working group will provide materials to support the housing providers in this effort. Health centers will coordinate immunization activities or events with the public housing agency, provide the vaccinations, manage patient relationships, and hopefully enroll patients. To the extent possible, in their view, public housing agency representatives expressed to us that they felt strongly that bringing these events on site at the public housing agency or through a mobile unit would help both to build trust with their residents, and it would also be a statement that you are trying to make that this is that important and partners are invested in to bring it on site. This is, of course, a local decision arranged between the partners after the introduction. Next slide. So phase two reflects the broader, longer-term goals. The thought or the intent behind it is by creating or building the capacity in the public housing agency, plus building or strengthening the relationship and connection between the health center and the public housing agency through this immediate flu immunization effort, that will create a venue to improve community health and community health resiliency, through which the health centers then have a partner to promote vaccine awareness, childhood vaccines, potential COVID-19 vaccines, promote awareness of and linkage to COVID-19 testing therapeutics, and to identify and connect individuals in need of primary care and preventive services with their local health centers. Additionally, the successful models that are developed through this project will be shared with others as they come online in the future. Next slide. So if interested, I think we're going to send out a polling. If you know that you are interested at this point, please go ahead and respond to the poll and we'll get back in touch with you. If you have, you can also send me an email if you want to decide later. It's on the slide. I'm not going to spell it out because I think we'll be giving you the slides as a handout, so you'll have my name. Identify. So in this, we'd like you to identify if you have a current PHA partner, because some people do, and if you're implementing similar activities. You can also indicate if you have any public housing agencies of interest that you would like to partner with, if applicable, or we'll just do a match. What will happen is for the health centers that reach out, I will reach across to HUD and they will reach out to their public housing agencies to identify a partner. And the opposite will happen for the public housing agencies going the other direction. The Health Resilience Working Group will facilitate a joint electronic letter of introduction to both the public housing agency and the health center that will be from HUD and HRSA. After the introduction, we will check in with the health centers and the public housing agency to make sure a connection was made or if there are any challenges. And we'll be tracking that by on the working group. We hope to do periodic check-ins to identify, capture, and share successful collaboration models, best practices, and success stories from the Flu Lead site. We are especially interested if anybody has outcomes. There are no reporting requirements with this, but we are very interested. We know that a lot of people do that kind of work anyways. We'd be very interested to see that. Again, after the mutual introduction, the PHA and the health center will connect locally to make their arrangements for flu vaccination clinics, including on-site if that is, any logistics, the timing, etc. Next slide. And with that, I'm going to turn it back to Dr. Mills. And I will mention, though, since your health centers, and you probably were on the call last week with the Today with McCrae, they did go over some things as it relates to vaccination coverage. So you're aware that there are some FAQs on the COVID FAQs relevant to this issue. And as always, keep checking in because those update very regularly. There's also, they also discussed health center funding that may be used for that. And at this point, we understand that it would be the H-80 base grant, the COVID award, and the CARES funding can be used to support immunizations. So anything except at this point, we will seek clarification, but it is our understanding that the tested. The expanded COVID testing award is not for this purpose. Again, speak with your project officer for any questions about this or funding or scope. Thanks. I'm going to turn it back to Justin.
Thanks, Karen. Appreciate it. So I just wanted to touch base on kind of the materials that would be available, the resources that we're hoping to have available to you as you move through this. And, the idea being overarching that there will be a large level of customization based on kind of what you can offer and what the population is and whatnot. And then, the idea being that, with understanding, I guess, that there are a lot of resources out there and we understand that. And so trying to find those best and best suited sources for this particular project. They kind of break down into 3 areas, and we've tried to put a couple of these as examples on the slide. But you can see kind of these idea of general messaging type of resources, and that could be things like handouts or posters. You see a couple of things there. But things that are probably a little more relevant to our current times, which would be electronic things like, things that could be put on Facebook and Twitter, things that could be kind of distributed electronically. Additionally, looking at materials and resources for clinicians, we know that one of the best ways to get people to get their vaccines and improve vaccination rates is a strong recommendation from their provider. So working on, there's a number of toolkits that the CDC has right now, where they're working on how, clinicians can improve that and help to improve vaccination rates. And then, very practical kind of materials for clinic managers. How do you run an offsite clinic? What are some of the safety concerns and some of the things you need to keep in mind as you do those things? So again, there are a lot of different types of resources that we hope to have available to you, kind of for different levels and different strategies for moving forward. Additionally, we do know that many groups, both federal, such as the CDC, or federal partners, things or organizations like the Association of Immunization Managers and Immunization Action Coalition, are putting together materials that are specific for influenza vaccination programs during the COVID pandemic. And so as those things become available, we will obviously take a look at those, vet those, and make those available to you all. I think that's all I have.
Correct. With that, I guess we can open up if there are any questions.
All right, so we have one question from Tara Morris. I'm going to unmute you right now. And Tara, you've been unmuted.
Yes, thank you so much. I was trying to fix the screen to move over, so I hit that mistakenly, okay? But I do appreciate the information that you shared, being that we do work very closely with our PHA here in Elkhart, Indiana, and our local health department, which is Hart City Health Center. I think they may be on the line as too, but I do apologize. I was trying to move it.
Okay.
Hi, this is Bob Burns. Can you hear me?
Yes, I can hear you.
Yeah, Justin, in the ACIP recommendations, is there anything new or innovative that you want to pass along to the group?
Oh, thank you for reminding me. I did meant to mention those. So, the recommendations are fairly similar from last year. I do recommend that, folks, if they take nothing away from this, definitely take a look at that for your clinics, simply because, there are, from past recommendations, for example, intranasal influenza recommendations, as well as, there's always questions around our pediatric patients, the number of doses and whatnot for those. But in general, the recommendations have been fairly steady from the last year.
And this is Bob again, and this is just a question for Karen and I guess for Jason as well. And that is, so if one of the health centers expresses interest, and I know, Karen, you talked a little bit about the matching process. So should they, first complete that and you guys will initiate the effort, or should health centers on their own reach out, to their local PHAs if they haven't done so already?
We will offer a facilitated introduction. If you already have a relationship with them, we won't say no. But we are happy to make that connection. I think that's part of it. Not everybody has that. We'd be happy to know who you are as well, and just keep in the loop, because we will do the webinars and newsletters and any kinds of updates for you. So we would be happy to know who you are and who you're working with, because that would be great to follow.
And Jason, you had a host of great HUD programs that you referenced, but as people from health centers are reaching out, should they be on their own during, for flu vaccine, the flu vaccine initiative, or other health partnerships? Should they be reaching to the program, or should they reach to kind of a central point at the housing agency to get connected up with some of these other programs?
Great question. So what we'll do, through the matching process as one avenue, is actually, because we have folks that we work with at these different sites, we'll facilitate a connection to the best point of contact. In some cases, it may be the resident services director. In other cases, let's say where it's going to, maybe the best match might be at a Jobs Plus site or Envision Center, we might direct you to the program director. But in any case, what we're going to help facilitate is the buy-in from leadership on the PHA side, and also the connection not just to that one site, but to the entire portfolio of sites. So some health centers may serve an entire city or town, others may serve one portion of a city or town, and we can make sure we have a mapping facility that we can use to make sure that we will match you with the most appropriate locations and contacts. If you're reaching out on your own, I would really highly encourage you to look for the either resident services director at your local PHA or a program director for one of these programs. And then many housing authorities, will list on their website some form of resident services programming, whether it's FSS. They don't even need to be funded by HUD to run an FSS program. Many sites do that on their own without HUD funding. So I would encourage you to look there.
All right, so we have some questions that just came in. So I'm going to read one out loud first. This is by George Garrow, and he says, would you please reiterate the options for funding for procurement of the vaccines? Are the vaccines to be purchased by the health centers, the PHA?
Health center.
Health center. Okay. All right, and we have another question by Mary Young. Will there be any assistance in securing a vaccine? Most of us pre-ordered vaccines several months ago. It may be difficult to obtain additional vaccine.
This is Justin Mills. I can touch on that a little bit. That we do know that in every state. So let me go back up just a little bit. We know that there are additional doses of vaccine circulating, and we know that the CDC is working with health departments, and they are in fact partnering with community health centers to provide additional dosing of those vaccines. So it is something that we're still working on as far as being able to track all of that, in the sense that being able to connect folks there. But once we have an idea of who will be involved in the project, we can work with setting up connections with other entities to help them get additional doses of vaccine if possible.
Okay, thank you so much. And this other question is by Darian. Hi, do you have any guidance or resources regarding FQHC's policies or compliance when standing up a mobile health program or clinic and mitigating associated risks?
We can look for those for you.
Okay.
And let me also
And-
just share this. Oh, go ahead, Justin.
I was just going to say, yes, there are those resources out there, and we can make those available, especially around mitigating risk and providing vaccine clinics. Basically, there's safety checklists and things like that to help different providers provide those services safely.
And let me just touch really quickly on one, element of this program that we're hoping, is valuable, is that, as a working group, we're helping to coordinate. So the question earlier around, vaccines by being tapped into, CDC and other groups, to elevate these concerns and try to secure additional vaccines if possible. But, around the idea of mobile clinics, we have sites that are already doing mobile clinics and have already thought through some of these issues. So we're working to identify and highlight some of these model practices and have them available as sort of peer mentors for sites that might be looking to do this, so that you're not, reinventing the wheel. So we're hoping to that this will create a bit of a network where we can leverage some of the information that we already have from sites that have been doing this work in the past.
Okay, thank you so much. And we have one other question by Pauline. Well, there are two. So the first one is there funding for vaccines? And the number two is, do you want COVID-19 testing done as well? Or can that be determined with local partnership?
So I'll speak just quickly to the second question. I think there's a natural sort of marriage between the two. So one of the sites I'm thinking of, which is in Baltimore, they're looking to match their testing with vaccination, and I think that makes a lot of sense. So we can talk about, we're focusing on flu vaccination, but of course we know that there are catch-up vaccinations. There are other sorts of essential services that need to be delivered, and so we're hoping that this will be a touch point into engaging potentially with new patients and being to enroll new patients. So this is all part of the thinking.
Okay, at the
What
moment.
was the first part of the question?
Maybe just to respond to the first part.
Sure. Is there funding for vaccines?
So I think Justin touched a little bit on, that we're still looking into additional vaccines, but just from I would say, resource standpoint, one of the things that the housing authorities are bringing to the table, I mean, these HUD-funded programs are in some cases, multi-million-dollar programs. Sites also have at their disposal CARES Act funding, which is specifically, for things like this. So I think partnering with your housing authority could unlock potential opportunities. In some places we're seeing where their housing authorities and FQHCs are doing cost share agreements for community health workers who can do outreach around COVID and flu vaccination and other things. So I think, this is just sort of a start, but there's a lot more, because I think there's a natural win-win here between the populations being served, by starting the conversation to see what sorts of local resources are available and then how we can best support, from, again, the working group perspective.
Justin, can you elaborate on the possible uses of the CARES Act funding?
Sure. So, HUD has provided supplemental funding that was appropriated by Congress through the CARES Act to PHAs, and this is funding that's really available to address, COVID-related needs. So in some cases, this could be like procuring PPE. It could be, helping to facilitate, needed medical care and outreach. So if you think about a community health worker salary, that's something that, would be an expense, but also, some folks are looking to it to address concerns that have come up because of COVID. So things like digital divide and making sure that people have access to computers and internet, which can help facilitate telehealth, for example. So there's kind of a broad scope of things that could be considered, and PHAs are sort of going in different directions based on their local needs. But they would really be able. We're providing high-level guidance as an agency, but it's up to the PHAs how they want to spend, the specific money, which I think gives them a lot of leeway to work in partnership with, local organizations, including healthcare organizations.
And a question for Justin, going back to the there were some great examples, Justin, that you showed of messaging materials, both electronic and paper content. And I'm just wondering if you could just go back again as to how people would obtain access to that material. And I'm sure that some of the stuff will be covered in the kickoff in mid-September, but if you could talk a little bit about that.
Yeah, so, right now, I think we're still working some of that out. I mean, for the most part, we're hoping to have a clearinghouse for this information. And again, the idea being that, we would go through and curate these materials. Not every flu or COVID flu related, material would be useful for a health center or a PHA. So just kind of going through and making sure that they're reliable and kind of vetted materials, but then two, also that they are ones that would be useful for the population. And again, as these things are coming online almost daily, and different organizations are putting things together. And so as we have more of those things, especially around messages and messaging that's related to flu in the context of COVID, we would make those available. And again, I think I just wanted to interrupt. I'm not sure if I touched on this before, but the idea being that, again, a lot of these things will be customizable. We understand that not all materials don't fit all organizations, and so taking what you can from certain things and being able to customize them for your clinic, your population, for the way you want to release the information, whether it be physical materials or electronic or whatnot.
And Justin, one more question for you, and that is, how might an actual COVID-19 vaccine impact this initiative?
That's a difficult question to answer, since we don't have a vaccine right now. For the most part, we've, and this is kind of a professional way of thinking about, my professional opinion, even if we have a COVID vaccine, we still need people to get flu vaccination. Like I mentioned before, even without COVID, there's a high morbidity and mortality in the populations that we're focusing on just from flu. And so, it's important to get it in that sense. But I think that, trying to make calculations based on a vaccine, which, again, we don't really know when will be available and who will be available to, is somewhat difficult. But again, I have to stress, the real focus here is on flu vaccine, and we really want to make sure people get their flu vaccine.
If I can just add to that, one of the things that we've learned, and this is certainly part of the outreach and education that we're envisioning for this effort, is that there are real barriers to vaccination in terms of just some of the historical context and also trust. And so I think the vision here is that the more that we can build trust between residents and the health providers, not just as for the flu vaccine, but also as primary care providers, that the better situated communities will be when there's a publicly available, tested vaccine that, folks who want to receive that will have access to it. And I think that's really, something that we can build toward through this effort. So, the vision really is that this is the start of a longer term collaboration that again, hopefully is a win-win for both sides.
Yeah. And, one of the things that I just wanted to touch on too is, having that connection to care is very useful. We know that there's a significant level of morbidity and mortality related just to, other health conditions. So having that connection to care would hopefully, reduce those issues as well. So,
this for Justin, if there is any limitation on the amount of vaccine available, is there any prioritization in terms of basically which patients, which residents should be immunized first?
Sorry, can you go ahead and repeat that? I had a little bit of distraction there.
Sure. If there is some limitation on the amount of vaccine available for whatever reason, is there any prioritization in terms of which residents or patients are immunized first?
Yeah, the CDC actually has some guidance on this about patients who should be prioritized. And I have to go back and look at this again, but essentially, those who are older, especially those greater than the age of 65 years, those who are immunocompromised, pregnant women. There are a couple of other ones, like caregivers and contacts of high-risk persons. There's a long list, actually, that CDC has put together to help healthcare providers and clinicians prioritize those patients who need a vaccination the most.
Great. And with respect to the 9:15 session, so we have a date, and we're looking to get a time. And will all the folks who are attending this call be notified and be on the list for that, or do they need to look for some kind of notice? And I guess that question will go to Karen.
Yeah, I will definitely follow up and send it to them, and as well as we'll probably expand out as well to others, but absolutely, for certain.
Do we have any other questions?
Nope, not at the moment.
Does anybody else on the team have anything they want to add?
I just wanted to say thank you on behalf of BIPIC, or the Bureau of Primary Healthcare, for all of you attending, and thank you to the National Center for Housing and Public Health for hosting this for us. It's been a great help, and to all my partners on the team.
All right, well, thank you very much, and everybody on the line, please look forward to the notice, and I hope you'll be joining us on the 15th of September for the kickoff. And please I hope you all completed the poll, and if not, please get an email to Karen, advising of your interest. We're looking forward to combating this thing and making sure we don't have a really tough time with the double whammy of COVID and the flu season.
Absolutely. Thank you so very much.
All right. Well, take care, guys. Thank you very much.
Thank you.
Bye-bye.
Bye.